everybody, it's me, and today is March the 1st, 2014. And you guys, I have a story to tell y'all, okay? So sit back and eat some popcorn because this is a crazy, crazy story. As you can see, I still have my wristband on because yesterday I was at the hospital. Well, on the 26th of on the 26th of February, I had a regular OBG appointment with my OB, and everything went pretty good. I mean, I went there for my appointment. I was glad to see him. He wanted to check baby. He checked baby. Everything was fine. I did tell him that I was dealing with I had some pressure that was in my uterus. Kind of felt like I had a tampon or something up in there. And so what he did was he said, okay, well, just to be on the safe side, let's check your uterus. So he put the little probe thing in, and he did it vaginally, and he's looking on the screen. Now, y'all, remember when I told you when I first went to him and he checked my uterus, everything was fine. Just to let y'all know, and I'm not a good drawer. Matter of fact, let me draw it like this. No, I'm just going to draw it like this. This was what we saw when I first went in. This is Newt inside of my uterus, and he says, my uterus is perfectly closed. This time, Newt is all moving around, wiggling. And this is what we see. Uterus starting to open. So, I'm in like shock, like what? And he's like, he said, your uterus is starting to open. And then he was just like, hold on, because I was just like, what in the world? He said, what have you been doing? And I'm like, I haven't been doing any cartwheels or anything. Like, what's going on? So, anyway, he says, I'll be right back. He leaves out of the room. Now, all of these things are going through my mind. And then he speaks to one of the nurses, and then he comes back in and he says, we're going to schedule you for your cerclage before the 21st of March. The 21st of March, I would be 17 weeks. He said we have to schedule it as soon as possible. That was on a Wednesday when I went to go see him. He scheduled my cerclage for Friday, which was yesterday. And that was, yesterday was December the 20, sorry y'all, February the 28th, 2014. So, I cried on the way home, and I got footage of that, but I'm not even going to show it because I got too many mothers to be, and I don't want to scare anybody. But I was in my feelings, and a lot of things was going through my mind. So, but at the same time, I was really relieved to know that, okay, we can get this cerclage done. So, you guys, on the way, on the way, I tell my husband what's going on. He tells me to go upstairs, lay down. He makes some lasagna, dinner, and he tells me everything is going to be okay. And then, come Friday, which was yesterday, we had to be there at 1 o'clock. When you go in there, they take all your insurance information. First of all, they call you the day before to make sure, they ask you these questions like, are you allergic to this? Do you have this? Do you have that? Do you have a living will? I mean, they just go through the whole route of everything. And before I even got the procedure done, I asked the nurse there, are they going to put me under? She said, yeah, they're going to put you under. I said, okay, bye. So the whole time I'm like, bye, I'm going to be asleep. It's cool. So, I go and And just to let you know too, it was some things too that kind of got me a little upset because my doctor was like, "There's really nothing that they can do. The only thing what they can try to do." And so that was really, it just was really hurting me. I mean, it was things that was going through my mind, but I just said, you know what, this baby's going to be okay, and I'm just going to have faith. And I prayed about it and gave it over to God. So anyway, going back to them prepping me up or whatever. So they called me the day before and they asked you all of these questions. I had to be there at 1 o'clock, and we were scheduled to undergo the procedure at 3 p.m. So me and my husband shows up. They have valet parking. We go up in there and we are waiting. We showed up like 12:30, so we were there like 30 minutes early anyway. They took all my information, got my ID, got my medical insurance, all of that, card, copy of everything. Next thing I know, I'm sitting in this waiting room and I'm just waiting, and this other woman around is being called to go back, people that's being called to be set for particular surgeries or et cetera, et cetera. So anyway, at 3 o'clock is when they called me. I mean, I was getting a little upset because it was people that came after me and would be getting called before me. But at 3 o'clock, they called me back there. The lady was like, "I'm so sorry. I saw you sitting up there and you were waiting, and I wanted to keep getting you, but other people kept coming and this and the third." I'm like, blah, blah, blah. It's cool because my appointment was at 3, and now y'all calling me at 3. So they made all of the husbands sit in a certain area until like the wives, like you had to get dressed first and they had to put the IV in your arm first and then call the husband back, because she explained to me some husbands actually faint while they're, while their wives are getting all of this stuff done. So I totally understood. Anyway, y'all, I'm trying to hurry up and make this quick. So anyway, what ended up happening is that she explained to me, she put my IV in. She put it here first, but she messed up and was hitting something. It was burning. So she put my IV like right here on my arm. That's where you can see some of that little sticky stuff right here. And I was just like, whatever. I was just ready to get the procedure done. So I was like, yeah, so they're going to give me anesthetic. They're going to knock me out, right? She said, "Oh, no, you're getting an epidural." I was like, "What? An epidural? An epidural? Are you sure?" And she was like, "Yeah, they don't do anesthesia here when you're pregnant. They give you an epidural because they don't want anything to harm the baby." So I'm like, ain't this something? So I'm going to be awake for this. And it's going to be big needle in my spine. Oh. And so, anyway, y'all, right after that, my husband came back. I had to dress in the little robe and everything. He came back, and my husband was telling me through the whole time, stop fidgeting, because I fidget a lot. And so when he heard I was going to get the epidural, he was like, "You going to be still for it?" I'm like, heck to the yeah, because this is something dealing with my spine. I'm not going to be messing around with that. So anyway, sorry y'all, I took some medication. So anyway, after that, the anesthesia doctor comes in and he tells me this is what we have to do. We have to prick you one time. You're going to be like in a C position. And then what we're going to do is we're going to prick you on the back of your spine with something that's just going to numb the area. You're going to feel heat. And then after that, we're going to go ahead and prick you again with the epidural. Just be, translation, be still. So I said, okay, cool. And so my husband kept kissing me on my forehead, saying, "Baby, everything is going to be okay." He was very, very supportive. So, y'all, at this time, at this particular, and my doctor had came in before then, and he was all smiling like, "Hi, Ramona, you ready?" And I'm like, "Yeah, I'm ready." Like, I'm amped up. Like, my doctor has a great spirit about him that when he walks in the room, he's smiling. You can't help but to smile too. So I signed the consent to get everything done. Doctor took that. He went on. The anesthesia guy came in. He went ahead and explained everything. Next thing I know, I'm just laying down, and then these three women come, and they're like nurses or dealing with the anesthesia team or whatever like that. They basically tell me, "You ready?" So they wheel me on in the back. They tell me they're gonna lift me and put me onto the bed, And I'm like, okay, well, I'm not numb now and I can get up. They was like, no, 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 no. So I did what they told me to do. And I basically had to, let me sit up. So I basically had to sit and bend. I thought I was going to be laying down and bend. So it's a lady in front of me. She holding me and I'm holding her. And the anesthesia guy come. I said, "Come on, doc, let's make this quick, cause I'm gonna be real. I'm gonna be real still. I just need you to make this quick. You know what I mean? Let's do this." So he said, "Okay, you're gonna feel the first prick or whatever like that," and he did, and I felt the little warmness like he told me. And then I just knew, like, that epidural, I've seen it before. I've saw women get it on TV. I just knew that motherfucker is, excuse me, I just knew that bad boy is long. So I wasn't trying to think about that. I was like, Jeepers to the creepers. But on the inside of my head, I was like, Jesus, 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 calling on the Lord. And I could feel like something go crunch, like him hit something. And I was like, oh, I think you hit something, you know. So he pulled out and then he told me what to expect, like you was going to feel heat in your legs. Okay, the best way I can describe it is as if it's static all throughout your legs. And as if your legs go numb. But it's not that numb feeling like your arm numb. It's like kind of a drunken feeling, but it's in your legs. That's the only way I can describe it. You can't lift it. You can't do anything to it. It's just a heavy feeling. Like you can't even really feel down there. So anyway, they pulled me back on the bed. Everything was cool. They put the little proms out, and next thing you know, my doctor walks in. You ready to go? I'm like, yes, Dr. V, I'm ready to go. So I'm all on the bed like this. They didn't have to strap me down. At least I didn't think I was strapped down. There's another lady behind that's checking my heart rate. Dr. P had to go, and my OB had to go and actually get a Doppler to see what baby Newt was doing. And Newt had a heartbeat of 158, so it was pretty good, pretty strong. So they started the procedure. I'm just sitting there and I'm feeling like my body moving, but I'm not feeling anything at all. And my hands is like this, and I'm just looking around. And I spoke to the lady and I asked her, "Is this what y'all do when y'all give C-sections?" And she's like, "Yeah." And I'm like, "Wow." So, anyway, oh yeah, before they started it, because I told them I had to go to the bathroom, they was like, "Don't worry about that. The doctor would deal with that." And I remember him saying, "All right, the bladder's flushed out." I'm like, "How does you do that?" You know, a whole bunch of things was going through my mind. So anyway, I was looking at the time and it was before 5 o'clock, like 10 minutes to 5 before they started, okay? And then next thing I knew, at 5:15 or 5:10 is when they finished. And I'm just seeing how his vibe is, and he was basically like, everything looks good. So I'm thinking, oh, good, I didn't really dilate it or really go through whatever. So he explained to me what the cerclage was, because I was asking him, because you put extra stitches on it to make sure Newt stayed up in there. Because I'm thinking when you get a cerclage, they're going to stitch it like you're sewing something. He said, no. When we do the cerclage, we take the uterus and we close it. And we put a string around it and we pull it. It's like a purse string. So I understood that. So I knew what he was doing to me down there. So I felt like, okay. And he said, all right, 5 more minutes and I'm done. And y'all, within 5 minutes, we were done. So he said, everything looked good. You did well. And I said, thanks, Dr. V. You know, y'all smiling. I'm like, thanks. So once they were ready to wipe it, I felt the lady, I didn't feel her, but she's moving me back and forth, so I could tell she was doing something down there. So once they finished that, I realized, y'all, I'm right here. I'm laid down right here, and my legs are right here. Like they're up. And I realized, oh my gosh, these are my legs. Like, I thought these were like little handles. My legs were up, and I could not feel it. So my body was crunched all the way back. And I know Newt was like, what the heck is going on? I'm not used to laying like this or whatever. So, of course, after they finished, they checked baby heartbeat. Heart rate went from 158 to 155. And then they wheeled me to the recovery room. And y'all, I felt all of this right here, all of this was just flaming hot. And I told the lady, I'm hot. I'm hot. What's going on, dude? Is this gas? I just feel a burning sensation. She said, no, honey, that's probably some cramping. I couldn't feel my legs yet. They asked me to push down on, as if I'm pushing down on a puddle, and I couldn't feel my legs. So I was just like, whatever. So the lady had gave me all of these drugs, y'all, my IV. And I didn't tell her to stop either, because I was like, with whatever that was, I didn't like that. I thought maybe I was going into contractions or whatever. I just didn't like that. So the lady was pumping these drugs in me, and I kind of fell asleep a little bit. And then I woke up, and I told the lady, could y'all get my husband? Because if I'm going to be in here for 6 hours or whatever, he needs to know that. Go get my husband. So they went ahead and grabbed my husband, and he came upstairs and was kissing me and stuff and telling me it was going to be okay. I'm like, look, get the rubbing, rub my belly, do something, please. And so, he was very supportive, and bottom line, when everything started wearing off, I could feel the burning and the cramping in my stomach, y'all. And they tell you on a scale 1 through 10, I had to be a 9. And then they would tell you 1 through 7. I was like 7, 7, 7. Like, it was hurting that bad. And then they would not let me. I was trying to lay on my side, because I always lay on my side with her, because she's starting to get big now that I can feel the pressure when I'm laying on my back with her rising up. So I kind of lay on my side to kind of adjust the pain or whatever. So anyway, after that, the nurses were really nice. And when it started to wear off, when it took forever, we got out, we finished like 5:15. I did not go home, y'all, until like 9:30, almost 10 o'clock at night. And it's because they had to wait for that stuff to wear off. Plus, they don't let you go home until you take a pee. So, y'all, when I went in the bathroom and tried to pee, I felt like my vagina was a balloon. My butt, I could barely even feel. I told Matt that he can pop it with a daggone pin or prick me, and I wouldn't even feel it. And he started laughing. And so when I went to try to pee, nothing would come. And it was really surprising me, because I'm like, why is my bladder not working? Y'all, we went through that so many times that night, because they would not let you go home until you can pee. Would not pee, would not pee. They sent my husband back there with me. Matt turned on the water and everything for me. Would not go, would not go. They gave me tea, they gave me water. I went there a couple of times, would not go. The last time I went, y'all, I literally had to sit up, and I had to crunch down, and then I peed. It was like, psst, psst. I had to really like push myself to pee, and then it was so much pee that was coming out, so my bladder was full. So after that, they was like, I came in, all of the women in the recovery room, all of the nurses was clapping and everything. I'm like, yes, and I cannot believe how much pee was coming out. So the nurse was like, did the tea help? I'm like, I believe so. So they gave me instructions, basically what medication, when I go home. Now, hold on, y'all. Ooh. The medication that I'm on is oxycodone or whatever like that. That is the medication that I'm on. So, and it's strong, but y'all, I'm going to tell you something. I've looked up a lot of people who got the Cerclage done, including my sister. None of them had cramping like that, and it scared the bejesus out of me. I mean, I was praying, asking God, and God worked it out too, because them cramps went away. Once I slept them off, it was gone. But y'all, it was like, what? I guess some pregnancies are different. Maybe because I was just 14 weeks, that he wanted to make sure he sealed that uterus up. But whatever he did it. And the after effects was just crazy. It was just crazy, y'all. So we go home. My husband runs to the store to go. I told him I want my meds, and I told him I want some Jelly Bellies. I got in this bed and I told my husband, because usually he stays up a little later after me, he's doing things downstairs. I said, boo, I need you laying next to me. I really do. I told my husband he's like my little band-aid. When I'm hurt, his covering just helps me out. I don't know what it is. So he's laying, he comes, I'm up here taking medicine, like, going through the motions, hurting. And I call my husband on the cell phone, because we don't have an intercom here. And I'm like, boo, I need you up here. He was like, babe, I'm eating dinner. I'm like, get up here. So my husband comes up and he's like, all right, honey, I'm here. So I moved his arm back and I'm all laid under him. And I immediately, all of a sudden, I just started feeling good. I just started feeling really good. I woke up in the middle of the night because I felt like I had to make myself go to the bathroom. And usually, if I'm laying on my husband, if I get up and go to the bathroom, he'll move another way or whatever. But when I got up, I said, Matt, I need you to be still and stay in the same position. So I went, used the bathroom, came back, and I laid on my husband again and was feeling perfectly fine. Next day, perfectly fine. I'm still having a little after effects, more so not in my stomach anymore. It is straight in my uterus, y'all. It is in my vajayjay. It's like wonk, wonk, wonk. I mean, but not even on that. So I'm trying not to take this because I don't want Newt to be all hooked in there. But what I don't want is any type of early contractions or anything like that to bring it on. So I will say this is that I am so happy and I praise God that I was able to get this cerclage put on. Before Matt came upstairs in the recovery room, I was hurting so bad that I told the nurse to call my doctor. When she didn't call, I just said I was in pain, so they called my doctor back then. Dr. P showed up and was like, hey, Ramona, how's everything going? And I'm like, hey, Dr. P. Is like, your pain kind of goes away because he's all chipper and stuff, and I got all chipper too. And I'm like, it burns a little. And he said, oh, that's because you just had surgery. You'll be fine. I'm like, okay. So he leaves out, and I'm like, but I'm still hurting. So I don't know. But anyway, y'all, God is good. I had to tell y'all that story. I was trying to tape yesterday when I got home. I said, I got to tell the girls about this. I got to tell the girls about this. But every time I got to talking, I said, y'all, I'll speak to y'all later. So if I can put them clippings in here, I'm going to try to. But until then, you guys, I'm going to speak to y'all later because I'm going to get some bed rest. And I've never thought I would be having an epidural. But I'm grateful that sorry about that, y'all. We got cut off, but I'm so grateful that they have come up with certain situations like being able to get a cerclage put on. So I'm just praying, y'all. Just keep me in your prayers that we make it to our 40-week mark. Because it's been a really bumpy road, but I am so glad that my doctor caught that. I'm so glad because we would have been the odds. Most doctors don't even like to go into the uterus and, be giving them sonograms every time they see them. But because I am, now I know I am definitely high risk, he went in there right away and he saw something right away and he made a decision to get it done right away. And so the cramps really hurt, y'all. They really hurt. And I have a really high tolerance for pain that when I had my daughter at 20 weeks, I didn't do an epidural. I did everything natural. My period cramps are like off the chain, but these were really, really hurting. I thought it was going to be like when I went and got that D&C done when you couldn't feel anything. This was bad to the bone. You hear me? So, that was my adventure for, my 14 weeks. And, I'm really praying. And sometimes I catch myself counting down not just the weeks of my 40 weeks mark or whatever like that for August the 27th of my due date, but I'm really like, if I can get to 20 weeks right now, You know what I'm saying? Or if I can get to 15 weeks, because I know what can happen, and I'm just trusting in God. I'm okay right now. Like I said, right now I'm taking oxycodone, and I'm not, they said it was okay. I'm not really whatever, because I know, I'm pregnant. I'm trying to do the natural thing. I believe that did help a little bit with the cramps yesterday. What I am noticing is like my pee patterns are really off, y'all. And I'm feeling like a little ting in my foot, and I think it's because of that epidural. But I'm noticing that when I do, like if I feel like I have to pass one or something like that, I piss myself. Not peeing on myself, but a tinkle may come out. And right now, and I got pads on, so, or a panty liner on, so I go in there anyway, and I'm like, is this pee? I have not been bleeding. I only bled just a teeny bit after the surgery. When I wipe, it's clear. Nothing is there. So after taking the meds yesterday, I had to check on Newt. So I put my little Doppler up to Newt, and today the heartbeat was at 145 or 146, normal. So I said, okay, Newt, you up in there, you good. Because I know, like, mommy was drugged up, and I know you in there like, hey. But that was just my adventure or whatever like that. So you guys, until next week, keep me in your prayers. Let me know what's going on with y'all and your progress on your pregnancy. And until then, ta-ta for now.
Catch your vibe, genocide. Like then I testify. G, if you gave to me, tell me double didn't like it, so he shot to chest me. Told I lost my melody, the rose. We the salt of this world. Get back, bold, John.